Hi, it's Dr. Danielle Moore-Collins and I'm Clinical Director of DermaFace MD Skincare and DermaFace Clinic since 2009. So a person asked me about smoker's lines, and these are the lines just above the lips, and often they cross over the vermilion border of the lip. The vermilion border is the pink area of the lips. Best way to treat is to have a threefold method of treating, which is a combination of Botox and filler. But before even discussing the treatment, it's best to outline the reasons why you can be a smoker. Number one, sometimes people have smoker's lines who are not a smoker. That's number two. Number three, you could be a smoker and you quit, or sometimes you're just somebody who goes around all scrunched up a lot of the time, and maybe you're in a bad mood and or you're taking a lot of selfies. But for the most part, typically smoker's lines are caused from someone smoking, because the movement causes those lines, and then they're actually dynamic lines, and then they become static lines. So the difference between dynamic lines and static lines are, static lines, if you think, they're when you're stationary, when your face is at rest and relaxed. So I have no lines here when I'm at rest, maybe one or two little crow's feet, but when I scrunch up, you can see my crow's feet are more obvious. I typically use my triple peptide eye cream. I don't get crow's feet Botox anymore, but you can see my forehead are dynamic lines here. You'll see this area here is static because I have a scar there from Mohs surgery. So the difference between static and dynamic lines are static are present when you're stationary, and dynamic lines are occurring when you're moving. So in the case of smoker's lines, they are caused initially by dynamic, by the movement, be that pursing your lips together smoking, or being a non-smoker, or someone who quits smoking, or someone who just purses their lips together a lot, the way the people speak. So those are dynamic lines, and then they in time become static lines. So when you're at rest, they're still present. So how do we treat this? Really interesting, really good question. Number one, the first thing to do is inject filler along the vermilion border. The vermilion border is where the pink of your lips meets your skin. And again, if you inject this side, it should go the whole way up the tube here, and again, the tube here. I'm pretty accurate. Normally, unless there's scar tissue, I can just do one injection and it will go all the way up one side, and the same on the other side. Nobody's injecting the Cupid's bow anymore. That's very out of season. So once the vermilion border has a band of filler in it, that is almost like, I suppose it battens down the hatches, so to speak. Then you can also inject filler up from the vermilion border, just little amounts, little dots up and underneath the little lines here, because remember, every hyaluronic acid molecule will attract 1,000 times its weight in water. The next thing that can be done is to have a sprinkling of Botox along here. And again, if you ask someone to purse their lips, you can literally put half a unit or a quarter unit into each of the lines, and again, not up high because that will stop the mouth lifting up, just above the vermilion border. So it's just a sprinkling. Sometimes I do a little zigzag as well, and that tends to do quite well. The first thing as well to do is have the Juvederm placed in the lip here, because that will actually numb the area before you're then injecting, because it can be quite sore to have little injections going up and down along here. Much easier just to have one injection going here, and that will go the whole way up the tube of the